80% of the global burden for disability is recorded in low and middle income countries where my country, Cameroon, is found. Most people with disability come from families that are below the national poverty line. Without proper empowerment and implementation of what works for people with disability for improved livelihoods, the poverty and inequality gap will continue to widen for people with disability, and this will also leave them behind the evidence trail. People with disability are also more likely to go hungry. In partnership with partners from Poland, I led my team to develop an innovative toolkit called the e-based family-centered evidence toolkit for disability. This toolkit uses research evidence to improve on rights and needs of children with disability by mapping and auditing household practices to best available research evidence and policy. It focuses on economic security, food security, and reducing gender and disability disparities. Community health workers were trained to use innovation through software, that is Magpie and Max QDA, and their smartphones to collect data for auditing, feedback, and decision making. This toolkit is easy to use and can be integrated into health and educational system in low and middle income countries, and it also has the potential to generate big. This project impacts on the livelihoods of at least 100,000 children with disability through policy intervention for removing bottlenecks for possession of disability cards, thus giving them access to basic services. Following the UN Convention on the Rights of Persons with Disability and the Cameroon National Policy for Disability, community health workers use voice to improve on rights and needs of children with disability at household visits. This is reducing stigma and debunking myths for over thousands of children with disability. It has also empowered 30 households of children with disability with income-generating sick fund over very limited funding. These income-generating activities are helping to feed households and communities of children with disability as it creates market channels and also increase their ability to generate income used to support the needs of the children with disability and their households. This project is reducing poverty, zeroing hunger, and stimulating market opportunities for families of children with disability. With the COVID-19, we also reduce inequalities for acquiring COVID-19 resources for children with disability. Many children with disability are still left behind the evidence train and access to basic services. With this award, I'll be able to extend an impact on more lives of children with disability, thereby enhancing a world where everyone, including people with disability, have access to basic services.